Go.
Friends, Dr. Cameron Rokhsar here. A very common question a patient asks me is, what is the best way to lose abdominal fat, belly fat? So the answer to that is somewhat complex because I think we really have to look at this subject in a holistic manner. The first thing I want to address is that we all have two kinds of fat around our belly. So we divide it into subcutaneous fat and visceral fat. Subcutaneous fat is the fat that when you actually grab the abdominal area or the belly, you can pinch it. So that's pinchable fat. That's fat that is between your skin and your muscle. Visceral fat is a different type of fat that's intra-abdominal. It's inside our belly. It's behind the abdominal cavity, behind the muscles, and it's intertwined between your intestines. And the reason it's very important to differentiate between that is, first, they look different. Like I said, subcutaneous fat you can pinch, visceral fat you cannot pinch. Usually the way you diagnose visceral fat, these are people who have bloated stomachs. Their stomachs stick out, or some guys refer to it as the beer belly, right? So that's intra-abdominal fat that's pushing everything forward. The reason it's important to know that is because visceral fat, the only way to make it better is through diet and exercise. However, subcutaneous fat is where we as physicians can tackle the problem, whether it's through our surgical procedures or non-surgical procedures. But I want to take a step back and I want to address the science behind fat deposition. There's been a very intense amount of discoveries the past 10 years that really have shed a lot of light on why we deposit fat. And really it all boils down to your insulin levels. So insulin is the hormone that when you eat takes the extra calories that you've eaten and pushes it into storage, into fat storage. And it's been shown that people who have a lot of spikes in their insulin levels tend to store fat, versus people who have a very steady insulin level do not store fat. And so that really points to the fact that we need to eat certain types of diets that don't spike our glucose levels and therefore spike our insulin levels. So what's that type of diet? It's a diet low in carbohydrates and high in protein, especially low in refined carbohydrates like bread, pasta, rice, sugars, cookies, cake. These are things that all cause glucose spikes and cause insulin spikes, and it primes your body to push everything that you eat to go into your fat deposition, whether it's visceral fat or subcutaneous fat. So, as a quick pointer, if you want to get a better abdominal area, try to eat a high protein and a low carbohydrate diet. Stay away from refined carbohydrates like cakes, cookies, processed foods, bread, pasta, and rice. The second important thing that I think you have to address is exercise. And the reason exercise is important is at the end of the day, fat has to do with calories in and calories consumed. So if you eat too much and you're not active enough, you're not burning enough calories, you're going to store those calories as fat. So how do you increase the consumption of calories? Exercise. Now, I do believe that there should be two sources of exercise. I believe that aerobic exercise is great for immediate calorie consumption, but I think that weightlifting is also important just because the more muscle mass you have, the higher your baseline metabolic rate is, and so you burn more calories by just doing nothing. So I think it's important to really have a combination of those two types of exercise for optimal fat burning and calorie consumption. Now I want to, since we talked about kind of the holistic approach, I really want to talk a little bit about what we can do, what I can do as a physician to make your abdominal area better. So my go-to, and I think that's the gold standard, is liposuction. Now, liposuction, we've come a long way from the old days of liposuction. Liposuction has become a very simple procedure now. I do all my liposuctions under local anesthesia. We don't put you to sleep. It's easier recovery. You get up and go home. We basically numb the area through a fluid, and then we insert cannulas, and these are very, very tiny, small cannulas. Once you're numb, you don't feel this, and we insert these little tiny cannulas. They look like this. We insert that inside, and we basically, through a motion, we basically suction the fat out into buckets that are connected to a pump. So we can walk around a little bit, and I could show you the things that we use. This is a pump. So this is the pump we actually use for infiltration. We infiltrate the fluid to numb the area. The fluid that we use is a combination of saline, lidocaine, and so on and so forth. There's a cocktail that we actually infiltrate. The importance of the fluid is that not only does it numb you, but the bleeding is minimal because it constricts all the blood vessels. Then this is our suction machine. This is our pump. This is connected to some tubing, which is connected to our cannulas, and we go ahead and we suction the fat out. As I said, the recovery is very, very simple with this method, and people really get back on their feet within a couple of days. Your final result you really see immediately. You see your results immediately, but final results a couple of months later, you look better immediately. Again, the important point here is we can only address subcutaneous fat and not visceral fat. Lastly, I just want to talk a little bit about the non-surgical procedures we have for fat. Again, as I said, the gold standard is liposuction. There's nothing that even comes close to liposuction, right? There are other things that we have. For example, we have cool sculpting. This is a cool sculpting device. Cool sculpting freezes the fat. It's an attachment. We attach the area to the machine for about 35 minutes. Really, cool sculpting usually gives you subtle results. Cool sculpting does not give you dramatic results. Regardless of what other people say, regardless of what the company line is, the results are subtle at best. I tell people about 10 to 20% reduction. It's not comparable to liposuction, it's apples and oranges. There have been other devices that really have come and gone from the market, and there's been many of them. And cool sculpting is the only one that has had any kind of longevity. It's been around for 12 years. But this market for non-surgical fat reduction, there's been so many players that have come and gone. It just shows you that really there's not a good way to non-surgically remove fat. The devices I'm talking about, Zerona, Liposonics, Vanquish, UltraShape, these have come and gone, which means that they're fads. We have a lot of fads, they come and go. These are things that truly don't cause anything significant, and the market discovers that, but 5-10 years later, and there's a lot of wasted money and unhappy patients. I don't get into those things. I hope you found this presentation helpful. Remember, I always tell patients, summer bodies are made in the winter time. This is the time to think about it.